Recording in progress.
Good morning. Hello, my name is Tammy Tiller-Hewitt, and we are thrilled to continue our leadership webinar series. Thank you for joining us. Since we are in webinar mode, we will not be able to hear you, but we would love to hear from you. So if you could put any questions or aha moments or key takeaways in the chat box, that's kind of like applauding for your speakers today. We love that. So after the webinar, we will post a recording of the entire webinar on our website so that you can go there and download it and listen to it over and over again. So our 2022 webinar series lineup covers a whole host of topics. In January, we had a dyad team, a chief medical officer, as well as a CEO from different organizations talking about the top 2022 leadership challenges. If you've not heard that, I highly encourage you to. Today, we're going to talk about growth strategies that fail and why. We also have burnout, physician retention, and then we'll wrap the year up with top alarming and amazing leadership lessons. So in case you didn't know, Tiller-Hewitt has proclaimed 2022 as the year of the leader. And at Tiller-Hewitt, we have the distinct pleasure of working with healthcare leaders every single day. And really, we get a front row seat for all the challenges and triumphs. And we are humbled by their willingness to share their lessons with us, because we all know that it's how we all get better is learning from others. So to start the year off, as a tribute, we start to the year of the leader. We started our Leadership Lens podcast, which one of our panelists, Diane Moss, today was one of our guests on the Leadership Lens talking about smart growth. If you did not see that or hear that yet, I highly recommend you go and listen to that. And then, but we are on all 6 of these platforms, so you can find us anywhere. You can go to our website as well and sign up to receive notices when they're posted. And then last, for the liaisons or the leaders of liaison teams on the line, I don't want you to forget about the 2022 virtual web workshops that we have. We just finished one and got perfect scores from the attendees. Next week, we have a 2-day workshop for leaders of outreach teams. And I will tell you, for those who don't know, at Tiller-Hewitt, we've launched and relaunched and assessed hundreds of liaison programs over the past 21 years. So we try to just kind of download our head to yours, give you lots of tools and resources that you can put to immediate use. And I did hear from one of our colleagues in the South in a large Catholic health system that they have eliminated all business travel for their organization, because they discovered that after COVID, when travel stopped, that they saved tens of thousands of dollars on travel. So I think virtual education is going to be here to stay. So hopefully you'll get signed up. Again, we have the March 22nd and 23rd workshop coming up. So, at Tiller-Hewitt, our mantra behind the whole year of the leader is that we believe when the leader gets better, everyone gets better. And so that's why we brought this webinar series and the podcast and declared this year the year of the leader. Now, I want to talk to you very briefly before I introduce our speakers about innovation versus limitation, because I know there are many organizations out there that they don't have the bandwidth or the budget to be able to do strategy and implementation and execution like they want to. But today, I want to tell you, you have rock star speakers who have been in the front line creating strategy and execution for many, many years. So I want to change that from limitation to imitation. So when you pick things up today, I want you to use them. Even the Bible says there's nothing new under the sun. So I want you to learn from these leaders and feel free to take what you learn and implement them at your organization. Now, strategic growth, as you all know, is mission critical for survival of a healthcare organization, really any organization, but of all sizes. But research shows that 70 to 90% of strategic failures are due to poor execution. We get it so close to the finish line, but we don't cross. So, a lot of people will say, let's use the analogy of a building. There's the traditional way where the design is the leading activity. And we know the blueprint is important, but the building will fail or go way over budget and way over schedule if you don't first address things like the soil condition, the zoning laws, the skills and capabilities of the builders, and the capacity and efficiency of the labor and supply chain. So how can we be better and apply this? Well, we're going to show you today and how we can apply this principle. If you begin with execution in mind, or like Stephen Covey said in his book, 7 Habits, begin with the end in mind, you can lower the risk of strategic failure and even guarantee a return on investment. So Diane and Tommy are going to focus on specific examples, specific ways that you can keep execution top of mind. And they will show you how the critical execution factors can be assessed for readiness immediately. So what we're going to talk about today are what we've coined as the 3 C's. So I believe that Diane and Tommy both have cracked the code on these 3 critical success factors that will accelerate your measurable results through successful execution. So we're going to talk about evaluating conditions, and they'll take a deeper dive. We're going to talk about assessing and building your capabilities. You have to be capable and be able to deliver, and then assessing and improving your capacity. So if we're talking about throughput and bottlenecks, that Tommy always says, if you don't get the bottlenecks fixed, they're going to turn into choke points. So without further ado, I would like to introduce you to our speakers, and they're going to then take it further to introduce themselves. But Tommy is the Chief Operating Officer for Tiller-Hewitt Healthcare Strategies, and Diane Moss is the Chief Strategy and Digital Growth Officer for Beacon Health, headquartered in South Bend, Indiana. So Tommy, you want to take it from here?
Sure. I want to thank everybody for joining today. Before we get started, again, I'm Tommy Tiller. I'm our Chief Operating Officer. I also manage a good bit of our higher level, larger client work. So I'm still on site with clients, working with our software team as well. But at our core at Tiller-Hewitt, we are a growth organization. So a growth engine at the front end through assessing and developing growth strategies, and all the way through the back end to implementation. So I tell you all that to say this is what we do day in and day out. We do very little else other than go into organizations and assess their readiness for growth, develop in collaboration with leadership, growth strategies, and then we implement those strategies. So if I had to say where we are the strongest, it's in the implementation phase. So we are the execution engine for most organizations we work with. So we do those operational assessments, we do strategic growth planning. In many instances throughout that process, we are forced to do process improvements. So we have a lean division with lean certified 6 Sigma black belts that lead our process improvement work. We do organizational growth strategies as well as smaller scale service line and specialty growth strategies. And sometimes we go in and we focus solely on the employee network for those organizations that have large employee groups with major leakage problems or network optimization, care consolidation, whatever the word is of the year. We also have a very robust physician integration program, which is designed to rapidly ramp up physicians and probably most importantly, retain them in today's market. So to prevent that revolving door. We built that out of necessity, as our growth strategies were developed and we launched liaison programs around the country. The revolving door in some of our key specialties would tank our success, and it would make it very difficult for us to realize incremental growth. So we built a physician integration program. So we have a physician on our team that serves as our physician mentor and coach for our other physicians. We have a family and community integration piece to it, and ultimately, the physician integration program transitions to our growth strategy implementation team, and those physicians stick with us long term. At our core, what started it all was the liaison program. So we launch, relaunch, assess, and manage hundreds of liaisons around the country for hundreds of health systems over the years. And we support organizations in various ways. Sometimes we support them from the sales training standpoint, where we do on-site training for the teams. Sometimes we assess an outreach program and make recommendations for better utilization of the team. And sometimes we do it the full program. So we assess, we develop, we implement, and we're on site and with a team long term, and we really become integrated with an organization. We also have a very robust PRM platform, Tracker Plus. So we built that. This was another one we built out of necessity. So over the years, we found many of the PRM tools that we use to just not have all of the features and functionality that we liked. And those that did had so many features and functionality that they became a little clunky for our taste, or they were prohibitively expensive and organizations just couldn't afford them. So we built Tracker Plus with the input of hundreds of liaisons as well as our leadership team. So we like it a lot. It's also housed with internal referral data. You know, we've got some sources to get you external claims data as well. So it's a full service solution for you on that end. So without further ado, I will kick it over to Diane to talk a little bit about her experience and Beacon.
Thank you, Tommy. So good afternoon, and thank you for having me. I'm Diane Moss. I'm our Chief Strategy and Digital Growth Officer at Beacon. I've been here for 32 years, and I've had the pleasure of working with Tiller-Hewitt on kicking off our physician liaison program probably about 15, 20 years ago. So I've known Tammy for a long time. So just a little bit about Beacon before I get started. Beacon Health System is located in South Bend, Indiana. We're an 8 hospital system with about 350 employed physicians across northern Indiana and southwestern Michigan. So everything we do is centered around our mission, which is to deliver outstanding care, inspire health, and connect with heart. So I'm going to kick us off today by talking about our growth strategies that work. And when we really look at growth strategies, we start out with data. We do surveys and market intelligence with a feedback loop. And so you'll hear that throughout our presentation that both Tommy and I focus a lot on the data and getting feedback and using market intelligence. So I'm going to start out by talking to you about our actual planning cycle and how that helps us with execution. So for us, and this is just an example of our planning cycle, and it does say 2018 on it. And I decided to use this slide so that you could actually see kind of the circle that we use: strategy, vision, and alignment. Every year we add to the cycle, and our cycle has gotten so large that I can no longer fit it into this format. So it's like 3 or 4 pages long at this point in time. But I really wanted to show you that for us, strategic planning is really a circular process that never really ends. So we don't do a strategic plan, put it on the shelf, and hope that somebody reads it after it gets board approval. We actually live our plan every day. And we do a lot of different plans: strategic plans, service line plans, marketing plans. But we live by what we call our strategic plan that we'll talk more about, like level 0 planning and so forth. But we really start out by our strategic plan. So I'd like to start out by telling you how that works for us. So next slide. So our strategic plan ends, so Tammy always says start with the end in mind. So I'm going to show you the end of our process. The end of our process with strategic planning ends with what we call level 0. So our level 0 actually guides us in making sure that we're executing. And so all of our strategies have tactics attached to them and metrics, and we roll out what's called a level 0 scorecard. And this just gives you a quick glance at what that looks like, but it also has signatures on there. So when we actually approve our process, once it gets board approval, we have everything laid out. I ask our executive team to sign it, and it comes along with a clause that says, I understand our strategy, I agree with it, and I buy into it. And so those executives all sign off on it before it rolls out to the rest of the organization. So our plan is really designed around 6 strategies. And so I'll share with you how we actually get down to those 6 strategies each year.
Hey, Diane, I have a quick question. Have you ever had to go back to this page to remind them?
Oh, Tammy, maybe once or twice throughout the process. You know me, I'm not afraid to bring the signature page back out.
All right, just wanted to ask.
Yeah, oh yeah, especially the first time. Yeah. I haven't had to in the last year or 2.
Awesome.
So we use this cycle for strategic planning, and I'm going to spend a few minutes on this slide because this slide for us drives the discipline. It's a very systematic process. It focuses on the future, and it really helps us translate what we want to do into our vision. So Tammy's heard me use the words now, near, and far. So we start out with where we want to be now, get us into the near, but everything's with the far in mind. So when we do strategic planning, you know, our cycles tend to be 3-year cycles. Also want to think about where we want to go in the far. And that far can be 5 to 10 years out. But if we're not making the decisions today that will get us there, then we're not doing the organization fairly, because, you know, if we're not planning for the future, we'll never get there. So we call ours a situational analysis, and that situational analysis really gets into all the data gathering. It's the surveys, it's, you know, evaluating the SWOT analysis, it's doing all of the, you know, looking at your pricing strategy, what's your quality, what's that key external opportunities and challenges, you know, what's the competitors doing, what's the data telling you, market share. We spend so much time digging into the data, and I'm a data geek and I love it, but not everybody on our team is. So we have to synthesize that into workable bites for people. And we do this like in that April-May timeframe, where we can actually roll out the data in about 2 4-hour sessions for our team, so that they can get that data, that physician needs analysis, market share analysis, service line analysis. What are some of the legislative challenges coming out? So there's a lot of work that's done there. And then what are the key trends and drivers that are going to help us make the decisions of what's going to end up on our level 0 for that year? And then what are the implications of all of that data that we gather? Because those implications are going to drive us to our strategies and tactics for the year. And then keeping our mission, vision, and values in mind, what's our future state? And so we have 6 strategy teams that roll out. So I lead 2 of them. I lead smart growth and consumer-driven culture. And so we do proposed tactics under all of those strategies, and actually come up with what our goals and tactics are, and eventually metrics, although that comes a little bit later. And then we bring that back to the group and to try to get the alignment. Does everybody agree? And each year we evolve that process a little bit. So that happens over the summer. And that's where if we do really good planning, we can execute. But if we fail in this planning process, the execution is going to be weak. So we don't even talk about budget until we have the plan done. And so sometimes when we get to budget, we have to go back and realign some of our strategies because the money may not be there. So if the money's not there, if the capital's too tight, we may have to adjust in our now near far strategies what we can do in this calendar year to get there. And then the part that's probably toughest for everybody is your workforce planning, because right now workplace is a big issue. I mean, human capital, right? It's hard to get. And probably the key saying that I've had lately on some of our smart growth projects is the human capital issue is going to trump our strategy, because we are not able to hire people to fill some of our strategies that we have. And then the digital planning, you know, making sure that we're automating as much as we can do. Once we've done all of that, then we get into execution. So we have a very rigid, I shouldn't say rigid, probably very, well, I mean, I'm going to use rigid. We do have a rigid strategic planning process from that. So we have anybody who has a plan that's over $500,000 has to complete a very detailed project plan. They have to have a committee that's formed with certain people on it, certain groups of people, to make sure that it's well thought out, and then it has an approval process to go through. And then we get into the action plans. And then it's the evaluation. Evaluate to make sure that we're measuring it, that we're hitting our goals. And if we're not, where's your plan? So we have what's called a quarterly results review, which drives that process. So if you're in the yellow or green or yellow or red, you have to come with a plan of how you're going to fix that. Then we learn from that, do a course correction, and we start all over again. But that's our discipline.
Can I jump in for just a second?
Sure.
Sorry. This is just made me think so much about how important data is at every phase in the process, from the strategy development, understanding what the conditions are with external market conditions and claims data, to the evaluation and ultimately the evaluation internally on volume, internal referral data, where are our volumes and our metrics, to be rigid about our goals, but a little flexible about the way we get there, depending on what the data tells us. So we don't want to, be married to a poor strategy when we have new information in front of us that could potentially let us pivot and get to our goal more effectively and efficiently.
Oh, absolutely. And you can do everything right. So one of the projects that I actually worked on under Smart Growth was opening one of our small acute care hospitals. Well, who would have thought that we'd be opening it in the midst of a pandemic and you couldn't get CMS to come do a visit? So it blew up all of our projections because, without CMS approval, you actually can't get the payers to contract with you. And so we didn't hit our pro forma on that. So that was one where you executed everything you were supposed to, and market conditions actually impacted the execution.
That's good. I like when you talked about workforce planning, I heard a term just this morning that we're changing it from the great resignation to the great reshuffling, that we have to think about how people are reshuffling even outside of our industry. So not to limit ourselves to look for people who, we would all before have thought of as the healthcare worker, that it could be anywhere. We had a vice president drive through McDonald's the other day and ran into this really awesome clerk, and she was so awesome. He's like, hey, you ever thought about coming to work in a doctor's office? She's like, no. How much do they make? And it was more than McDonald's. So that was good. So the great reshuffle.
And the inverse of that is we're losing some staff in our healthcare organizations to the likes of McDonald's as a result of the great reshuffling, if you will, and higher wages being necessary at all fronts. So it's, becomes difficult to staff a patient access or the front desk at a clinic if we're not competitive with salaries, because, HR has the tendency to compare our patient access reps with the patient access reps across town and not the clerk at Lowe's, which oftentimes is where we're losing some of those folks to now.
Yeah.
And part of the tactics is, growing your own, because there just aren't enough people out there.
Yeah.
But so this has been our process, and I will tell you it's worked well for us. And every year I find that we tweak something. So it's not hard and fast, but we do tend to follow this and add different groups of people in, and add different data sources, and it's worked pretty well.
Well, I love that it's very easy to follow too. I think for even our attendees here, you can see it takes you through the where are we now, where do we want to be, how do we get there, what must we do now, how are we doing? Those small questions, I think, Diane, are genius. That just sums it up.
Well, Tammy, one of the other things that so I'm a planner, right? That's kind of been my career, but I also in the beginning of the year publish a schedule for the people involved in the process, so they don't have to wonder, when's it going to start? What do they have to do? They get a schedule in the beginning of the year outlining all of their expectations, which meetings, which education sessions do they have to be at, when are things going to be due, so they can build it into their calendars, and we're ready to go. So it's become kind of this process that people are getting used to. And it used to be, more the executive team, the board, some physicians. We've brought that down to executive directors, VPs, and some directors to be involved in this process, and then ask them to take it to their teams. So I'm not a huge fan of SWOT analysis, but I know that's part of strategic planning. A lot of people still use it. We use it too. So we asked people to do SWOT analysis at their department levels last year. Our board likes that process. So we do go through it, and then ask them to feed the information up to us. We do a formal survey with leadership and push that out for people who want to provide the feedback, physicians included in on that. And so we do get a lot of feedback. We attend a lot of meetings asking for feedback. So if people aren't in the formal process, they can provide that feedback through other mechanisms.
That's awesome. One more thing, and then I'll move to the next slide. But for everyone listening, what I found is the biggest missed opportunity in organizations when they're doing a SWOT. I know what you mean about SWOT analysis. You know, everybody, you think they've served their time and they need to retire, but that's how we get teams engaged to do a quick SWOT analysis. But my point to this is oftentimes we don't have an objective for our SWOT. So if I was going to be doing a SWOT analysis on parking at my organization, my strengths and weaknesses would be a lot different than if I was going to do it on strategic growth or employee morale. So you have to have a very specific objective before you sit down and do a SWOT analysis with anything, or you will chase rabbits all day and you're like, okay, how is this going to make me grow again? So I love that you're still doing them. So what about this slide about your process?
Yeah, this just defines it a little bit more on gathering the input, some of the things that we do, you know, the SWOT analysis, the customer expectations. We still do some focus groups, surveys, the competitor analysis. We do spend a lot of time mapping out where our competitors are compared to where we are in the areas where we want to grow, especially. Recently, we've focused a lot on the digital, the onboarding, the consumer onboarding areas to see where we're strong or where we need to move a little bit faster. And then just really, you know, continuing, even though you have your strategic plan is kind of like your larger growth plan. You still have to start building plans and tactics within those. So when I think about my area of smart growth, like I've got 4 or 5 construction projects right now. They still required plans under the strategic plan to make sure that those are on track, working, that we did the data for each of those plans. And so it isn't kind of a one and done strategic plan. So you still have to do the service line plans. You still have to look at the market share as it comes out each quarter and be mindful of all the changes that are happening. And I think a lot of people think, oh, the strategic plan's done for the year, I'm good. Okay. Now, this is still kind of an ongoing process. And then monitoring those metrics, that can be a full-time job. So we've worked really hard to automate the metrics, and so that it isn't, you know, waiting for it to come out on a quarterly basis. They have to be real time. So one of the things we're measuring for access is third next available appointments on physician offices. Because for us, it's about, can you get the consumers into your system? Because if there's a roadblock getting them in, your growth isn't going to be there. So we did real-time availability on third next available, that every office can look at theirs, they can look at it by physician. So we built a lot of those metrics live in our system. We still have work to do on that, but we've tried to provide as much as possible that's readily available to people who want to use them.
Gotcha. I do get the part that it's time consuming and people, you know, confuse it with a one and done process, but it's a living, breathing, constant. And that's how people soar past their competition, is it's not, you know, a one and done meeting, we signed off and see you next year. Tommy, do you have something that you wanted to add to that?
I don't. I will when I start talking on the next couple of slides.
Okay.
So I'm going to go really fast through this section because otherwise I'm going to take Tommy's time. And this is one of my favorite projects that I've worked on since I've been at Beacon. So our overall strategy was to grow market share. The tactic was to develop an area that we weren't getting market share in, and we called it our Capitol Road catchment area. So this was the catchment area that we defined. The next slide actually shows. So this is one of the individual plans we put together, just a few slides from it. So you'll notice, like in the middle of the slide, the orange area. So if you can see that, it's showing that in this particular area, we weren't getting the market share that we should compared to some of our other areas. So our system enjoys about a 60% market share. In this particular area, we're in the 36, 39%. This also happened to be an area where the payer mix was really good. So not a great area not to have high market share. So our project ended up being, we weren't sure what we were going to do when we started it. It ended up being a small acute care hospital that opened up at the end of 19, right before the pandemic. And these numbers are significantly different today. But as you look at the next one, we also brought in expert growth projections. We use SG2. Sometimes we use advisory board, but generally SG2 is who we use. That showed the growth forecast for the area. In that area showed that we were going to continue to grow. So it was a good market. Then we actually got into the particulars on this slide. I know it's harder to see, but the light blue circles was our competitors' market share in that area for emergency rooms. So if the patient ended up in the emergency room, we weren't seeing that inpatient care on some of the areas that we were the trauma center and we were the children's hospital. So even those services we weren't seeing. And so one of the things that we were going after was not only increasing the ED visits, but increasing the market share on specific service lines. And so we've been open just about 2 years. We've already increased market share 14% on the emergency room side. So it's been an incredible journey. I would share what our profit margin is there, but it's really high. And last month it provided half of the revenue for the health system. Now we had a really bad month last month, so that's probably not saying a lot. But we are now on year 5 projections for this facility. So this is an example of when you do the research, when you have the right project, when you execute, the results are worth all the planning. I will say this project took me 5 years to get through the approval process and executed and open. So I think everybody's wishing we would have done it earlier because the results have been so phenomenal. But this has been a very rewarding project, and one in which the results continue to generate month after month. So again, execution when you plan well can be very, very rewarding.
Yeah, that's awesome. Tommy, do you have anything to add to conditions before we move on to capabilities? No?
I'm ready for capabilities.
All right, let's go.
All right, so capabilities and conditions overlap a bit for our work, but we like to try to focus the right people on the right things. And our first step with almost all of our client work is an assessment. So we call it a strategic growth readiness assessment. And this for us just has to be the first step. So Diane spoke about her assessment process when developing the bigger strategies, longer term strategies, but honestly, basic blocking and tackling type of an assessment is necessary for us, because to develop a plan to get where we need to go, we've got to know where we are, truly know where we are at every step of the way and why we're there. So if you're able to accomplish this piece, you'll set yourself up for long-term success, because you'll quite frankly know what is and is not realistic in the now and near term. And from my experience, we almost always find a few things that bear fruit, profitable fruit immediately, and a few things that need to be addressed before any growth strategy can be executed. So our assessment process consists of pre-assessment surveys that we send out to hundreds of key stakeholders within every organization, including physicians, leadership, frontline staff. We assess and analyze all access points into strategic service lines, capacity in strategic service lines, capabilities of those service lines in current state, and what the referral processes look like, referral data, availability, utilization, sort of you name it, we get our hands on it while we're assessing an organization so that we can make solid recommendations. My advice is to give this step all the time that it needs and deserves. It's more than just a current state assessment. For us, and for probably most of you, it will be a crash course on your organization from all angles and all access points. And it is a fantastic way to start the process of stakeholder involvement and create a culture of what we call strategic inclusion. So we then go on site and we interview 50, 75, sometimes 100 key stakeholders. So it's a lengthy process. And then we develop the growth strategy based on those assessment findings. So some real life examples from some of our recent client work is, we found blocked MRI slots for patient transports that are costing us millions of dollars a year, underutilized ORs due to circumstances that are in our control and fixable, inconsistent clinic templates that are causing leakage from our employed enterprise. So there are many things that we find in an assessment that are so simple. It's just that no one has looked at the entire organization sort of holistically to see how everything connects to everything else. Also taking a look at marketing strategy, if our marketing strategy is aligned with our growth strategy, and we take a close look at access and capacity, because we can't execute anything unless we have the access and capacity. And there's nothing more dangerous for us than to go out and ask for business that we can't accommodate as an organization. What you'll also hear during this assessment are a lot of stories about those that came before you to try to do what you're doing and they failed. So why are we even trying again? We've always done it that way, sort of a mentality. And it's mostly because they gave up. So, we'll get into execution in just a second. From the assessment, you can determine if your capabilities and capacity in your key growth areas will support your strategy. So, when the Dianes of the world and her team develop these robust strategies, we get down into the weeds to see what needs to happen in the short, mid, and long term to realize these. And all of this work is in the interest of developing plans that are executable. So again, starting with the end in mind and prioritizing our growth plans and growth strategies for those service lines and specialties that have the capacity and capabilities for that desired growth in the short to midterm. Service line development is another key component of any growth strategy. So if we determine that our current capabilities and our capacity don't support the strategy, it's important to rally the troops and align on how we get from point A to point B. This team is really a longer term strategy team for us, because in many instances, this team will be working to enhance our capabilities, which can be trickier than enhancing our capacity. So if we don't offer a service line, or if we don't have the expertise or service excellence to offer as well as the competition, those are things that we need to work through at a high level and potentially a longer term level. So things such as capital investments, such as Diane's plan, we have to take a hard look to see if that's something that we can accomplish in the short and midterm. And if it is not, the plan moves forward, but it becomes a longer term plan and less of a short term executable plan. And last but absolutely not least on this is accountability. So for any of this to be effective, and for any of it to be executed well, what you all are doing has to have teeth. So it needs to be championed by senior leaderships, consistent and regular meetings that are well documented. So this is the most basic thing in the world, but minutes. I can't tell you how many organizations we walk into that have high level meetings and no one takes minutes, and we go back to the meeting the next month and we talk about the same things, and 3 of the people forgot to take their action items because they didn't write it down. And it will save you so much time if we take minutes, assign action items, we follow up on those with cadence, etc. Diane or Tammy, anything you would like to add to that?
No, I'm good.
No. I'll be interested what you talk about next after the assessment and all the capacity issues or opportunities that you uncover. Okay.
So, moving on to capacity, which, so a lot of this capacity and capability work happens simultaneously, but around capacity is removing bottlenecks and choke points. So ultimately, keep it as simple as possible. We've got to be able to accommodate the business, and we have to stress test every point along the way to ensure that it can handle the business. So bottlenecks become choke points very quickly in places like patient access and in our clinics if we are not appropriately staffed for the growth that we always will see when we develop and execute a growth strategy. So growth teams are essential to our process, and Diane talked a lot about strategy at the highest level. So when that's solidified and our senior leadership teams aligned and we know what we have to do, now it's time to solidify this plan and get buy-in from the operators and our physicians. So, think of you and your leadership team, or for you leaders on the line, as the coach, but we've got to get our players, our docs, our operators, our frontline staff to buy into this strategy, because they're ultimately going to be the people that make it or break it. So we need to make sure that we have a unified vision. This is a place where we often see strategies break down. One of a few places when we develop strategies with, physicians in mind, with growth in mind, and we forget to talk to those folks that are going to be responsible for accommodating that growth. And they either don't see it coming, they're potentially not aligned with our growth goals, And when those things happen in combination, we really struggle to execute. So, those teams need to align on value proposition, our growth goals, again, access and capacity. Note that sometimes perceived access and capacity issues and real access and capacity issues are not always the same. Sometimes they are, but in the event that they're not, this is where we can do some work to improve perception. We can virtually increase capacity through process improvement, which we'll talk about in just a second. But if access and capacity are able to accommodate, for us, the primary focus is outreach, marketing, awareness, and really showing the market what we have to offer to shift that market share in our direction. Taking a look at access, wait times, and availability. So path of least resistance is key here, and it's the motto of many of our execution strategies. We have got to be the path of least resistance. So from a data analysis standpoint, we're not only looking at our own data, but we're looking at competitive data. So sometimes that's secret shopping, that's talking to people that use the competition, because to be successful, we typically either have to have the best price, we have to have the easiest access, but we cannot, or the highest quality. So, but we have to have two of those three, in my opinion, to be measurably successful, at least in the short term. So access and availability, oftentimes, to be honest, trumps even quality. So we pay a lot of attention to ensuring that we're the path of least resistance. And a lot of the roadblocks that organizations put up are at the front door and with frontline staff, which is why it's so key to have operators and frontline staffs in these teams. Next is process improvement. In almost all cases, all of this great assessment and strategy work will shine a very bright light on the areas where access and capacity are stressed so much that they will be a roadblock to your growth. So I suggest you get in front of those barriers early and often to ensure those bottlenecks don't become choke points. For our clients, our lean teams come in and we get the teams together. We show organizations how to lead these events, and we help them create action plans, and then we train the trainer. So ultimately at Tiller-Hewitt, our goal is to build something that will last long outlast us. So we train the trainers in a lot of instances through our engagement. So when it's time for us to go, everything that we help put in place can stay in place long term. And doing all of that and standardizing our processes through process improvement will allow us to systemize our operations and allow our processes to be repeatable and consistent, which is what the marketplace and what most of your referring physicians want. Even if it's not perfect, most just want it to be consistent so they know what they're going to get every time they use our organization. Tammy, Diane?
Oh, I have a lot to add to the process improvement part. So as Tommy, I'm one of the lean advisors that go in and help with the PI events, but I will tell you that, everything that Tommy said is truth, but I'm going to peel it back a little bit for you. So growth teams, let's just say that in the surveys that he talked about, we asked the question, what are the top 5 barriers to strategic growth, physician engagement, and in-network referrals? So all the things we want, right? The number 1 was scheduling, the number 2 was access, and number 3 was teamwork. So we find out that there's serious access issues in this particular organization, which is not uncommon, but we don't just take it, at word value. We are at face value. We want to find out, what does that mean that access is hard, scheduling is hard? Well, and we do this with all organizations, but we find out in scheduling, when we have all the ancillary departments there to help us understand, what is it like to schedule a patient with your department? In this particular organization, there are 5 questions that are asked in some departments. And are you ready for this? Wait for it. Wait for it. In other departments, they're asking 54 questions every time they schedule a patient. So guess if somebody has 5 CTs, let's just say they want to schedule with our organization, and they have a kids game, or they want to get out at 5 o'clock, and they're like, let me call this hospital and answer 54 questions per patient that I schedule, or I call the imaging center across town and they ask me 2 questions. Guess what? So we know. So that we're going to lose business because we're not the path of least resistance. And Tommy said it, we win business and we don't even have to be the highest quality if we're the easiest to do business with. Second is, we found out through another assessment that some of the specialists were not working their contracted hours. So they were given extra money and extra staff if they were going to spend more time in the lab at the hospital, in a procedural lab. We found out that they weren't, and no one was managing that. And that was worth $6 million. So there are tons and tons of opportunities that if you slice and dice and you get these process improvement teams, growth teams, service line teams together, it does take a village, because you have to have anyone that's going to touch a patient, a physician, or a referring staff member. Tommy, did you want to say something back to that?
I did not know.
Okay. And then last is, a lot of times the departments are trying to survive, right? Everybody's short-staffed, everyone's busy. So Tommy's doing a cardiology service line team. He's working at a high level with senior leaders and the physicians. I'm working on the access, on the process improvement. And we find out that because patient access is down 14 employees, there's a long wait in registration. So one of the departments we're closing the last 2 hours of every day. They weren't scheduling high dollar procedures because they didn't want their staff to work overtime. So through that process improvement, and it's a process thing, it's not a people thing. No one wants to do anything wrong. They're just trying to survive and get patients through. So we were able to open up just last week 33 spaces for echoes a week. That's a lot of money. So that's a lot of patient access, and a lot that Tommy can go back to the cardiologists who are complaining that they want to send business, but we can't get them in for a month. So then he was able to deliver that good news.
Yeah, and Tammy, I think the thing that I would add to that one is, for me, so process improvement, I think, is super important. I would even push it a little bit further to more change management and automation, because we can't just automate current processes. We have to change some of our processes too, and give the docs offices access to scheduling online, and we don't have to control everything. And I think sometimes it's hard to change mindset that we have to actually see every one of those ourselves to do.
Yeah, agree 100%. Yeah, we've got to figure out how to automate things, everything that we can. Go ahead, Tommy.
Well, and automation often comes with releasing control. If we really want to automate some things, and just thinking about, all the employee groups we work with, it would make everyone's life easier if we automated and opened up templates, except the physicians, and they would lose that control to leave at 2:00 or to take this lunch, or to just have control. Sometimes most of the time it's not a work ethic thing. It's a control thing that, no one's going to control my schedule but me. And that causes inconsistent processes. It causes frustration from referral sources. And by the time some of those things trickle down to frontline staff, the message is so muddied up that the poor scheduler says, Dr. Tiller doesn't only has 2 new patient slots a day. Now, if you talk to Dr. Tiller, he would say, no, that was a template we used 5 years ago. I'll see anybody today if they call my cell. Well, that's all well and good, but no one's got time. 20 people don't have time to call your cell every day. So back to the automation. And one more, little nugget story of just to show you how simple sometimes multi-million-dollar growth opportunities can be realized. At a client where I think I have a couple people on the line, but I'll protect the innocent and save the names. We are trying to grow urology regionally out into an area where there is a major market opportunity we uncovered due to some mass exodus of some urology. We started our outreach, and we found out that our schedulers at the front desk, based on some information that they received from a practice manager, were told that we were no longer accepting patients from that area. So they've been trying to send us business. We have a brand new urologist. They've been trying to send us business. And because at some point in time during COVID, there was a busy couple of weeks where we were really only prioritizing our own employed referrals, there were some potential new referral sources that were told that we were not accepting patients from this city. So we fixed that issue simply by having a conversation with the practice manager and with the schedulers to let them know that's not the case. Now we're back out in the field. We're going so far as that we're investigating opening up a satellite specialty clinic closer to that organization. so that we can draw in business, that will almost certainly be a multi-million-dollar opportunity that was nearly lost because of a mixed message that happened on a busy day 6 months ago between a scheduler. So,
well, that's a great story, Tommy. And it also talks about the value of the outreach team working so closely with operations and operations moving. You know, we have this 24-hour guarantee when our liaisons come in and report something that they have to have at least some news back within 24 hours to report it out so it doesn't fall through a black hole. And that's created a sense of urgency within the organization to communicate more timely with our referring sources. So I love that. That's a great, great story. So Tommy, you want to take the next slide, your famous quote?
Yeah.
Or story about it?
Yep. Yep. I'll go quick. Are we on execution? Oh, plan the work and work the plan. This quote came from my best friend, who's still my very close friend when I was much younger, who at the time was a door-to-door salesman. So he used to tell me, plan the work and work the plan. So he would say it over and over and over again. And it stuck with me so much that to this day, it's posted on the door of our office. So that's like my cue to keep it simple. Don't overcomplicate it when you get a little overwhelmed or stressed with the execution phase. We spend a lot of time planning this work. So work the plan.
Yep. Okay.
So after the strategy is developed, moving on to execution, barring any new information that's material to the sustainability of the strategy, commit to seeing the strategy through by any means necessary. So I think David Goggins quoted this. He may have stole it from somebody else, but don't stop when you're tired, stop when you're done. So what I mean by that is that this is complicated. It gets very difficult to execute a strategy. Well, oftentimes it's not complicated because you've done all the heavy lifting from the strategy standpoint earlier. Just gets difficult. So it's no secret to anyone that's ever worked with us at Tiller-Hewitt that this is what we do best and most often. We're the execution mechanism for our clients. So at our core, we are the by any means necessary that it takes to execute some of these strategies. So a longtime client and now a really close friend refers to me as the blunt force object that will run through walls to get a strategy executed. So strategies fail for one of two reasons. One, the plan was bad. Two, the plan wasn't executed as it was intended. Obviously, it's a little more complex than that, but most fall into one of those two buckets. So if we've developed a sound strategy, the trick is execution. So I will say that I personally have developed a couple of great strategies over the years, and I've developed a lot of average, basic, relatively simple strategies. I've also had my share of bad ideas, etc. But what's differentiated the success for me, and I think for most of us at Tiller-Hewitt, has been less about the complexity of the strategy, but how effectively we executed it. So 10 out of 10 times for me, execution trumps strategy. So we've got to get out there. The best strategy in the world, if it sits on someone's desk and no one is there to execute it with a regular and consistent cadence, it will not be successful. For us at Tiller-Hewitt, we leverage our liaisons and our outreach program, and that's one of the most critical components for us, is to have a team of brilliant, well-educated, and empowered outreach liaisons that are raising awareness, selling, and identifying and removing barriers. So that feedback loop is key to the continuing execution of our strategy. So a constant presence in key practices and a seat at the table with leadership to share the feedback and to problem solve. And, when I talk about our liaisons and our outreach program, I'm not talking about marketers. While we love marketers too, I'm talking about highly trained, highly motivated future leaders, shooting stars, if you will, that walk the walk, can act like a leader, have close relationships with their leadership team, and have the juice within the organization to go back and get stuff done when they hear this feedback based on physician integration. So I think there are many ingredients to our personal recipe for success, but this is the secret ingredient: having teams that are well trained, well educated, and ready to move and execute your strategy for you. Next is data. And sorry, I'm going so fast. I just saw what time it is. I said it before. I'll say it again. And I'll continue to say it. Let the data drive you. It does not lie, both internal and external. So the external data lets you know what the world looks like for the business that isn't coming to you. And the internal data, both referral and volume, is our report card, and it's our quick response system and our compass. It allows us to pivot quickly based on what's going on. So while the strategy may have been fantastic, situations may have changed. It may be working better in some areas than others. So we have to constantly look at that data so that we are, executing the strategy effectively. So this is another area where we see strategies break down within organizations as a lack of timely and relevant data. And we identify that at the assessment phase of our engagement. So by the time we get to this phase, if the organization didn't have great data, they do now. Next are the growth teams. So keep that strategy team I talked about earlier together. They're now our growth and execution team. So meet often, apply constant pressure to the initiative, and work as a group to remove the barriers as they come up. And keep a pulse on your team. Are the docs happy? Is our staff happy? Are they staffed up well enough to accommodate the growth that we've already realized? Are we approaching capacity? So all in the interest of getting in front of potential barriers before they stop us. And create communication and accountability mechanisms. So again, the now, near, and far cadence. Last, and I'll kick it over to the rest of the team to finish it up. But so a couple of traps to avoid, and I probably mentioned all of them throughout the way, but asking for business that you can't accommodate. You only get one chance at a first impression with some of our new potential referral sources. So don't get out in front of them and ask for business if we're not ready to take it. Assuming that every access point in your service line can handle that growth and can handle the influx. Making the assumption that our physicians are willing and able to grow. Assuming that employed equals loyal from our physician base. So when we're out trying to shift referral volume in our favor, sometimes we still have to earn it. Many times we still have to earn it. Assuming that if you build it, they will come. So in most instances, a proactive outreach and awareness campaign is necessary, and strategically targeting physicians with good volumes will result in a positive strategy execution. And the most important, in my opinion, is giving up too early. So it always gets worse before it gets better. And sometimes it looks so bad before it gets fantastic that that's the point where most before you have given up. Because it's hard. Change is hard. So change management within an organization, changing culture, asking people to work harder, get busier. It's tricky and difficult, and it gets bumpy along the way before you get to the other side of it. But I can assure you, when you do, it is worth every ounce of sweat that you've put into it.
Awesome. Well, Diane, what else do you have to add to the execution piece that we haven't talked about?
Yeah, so for me, it would be just make sure that you're monitoring, evaluating, and reporting back. Just making sure that that feedback loop is there, and that to start with, you got the right buy-in.
Okay, awesome. And then, of course, we go back to your monitoring system, which is awesome.
Yep.
Okay, so some final thoughts, Tommy. I know that you had said, know the difference between engaging and presenting, call us sooner. So strong, reliable feedback loop you both had talked about. So we do have, in the sake of 2 minutes, we do have one question so far. It says, what does it take to get a growth readiness assessment going? And what is the timeline from start to recommendations? Tommy, you want to take that one?
Sure. So what does it take to get a growth readiness assessment going? Probably the heaviest lift of that is to acquire all the data points that are necessary to appropriately assess the organization. So getting your hands on all the data we've got, our marketing strategy, our current strat plan, access points and capacity, productivity for all the docs. So that takes some time to get together. But that's the most important piece of it. Then developing, questionnaires to send out to key stakeholders, making sure you're asking the right questions, and then getting on site to have strategic conversations with those stakeholders so that we can understand the why behind the what that the data told us. And sometimes that, for us, sometimes we're inpatient access during that assessment. We're walking to imaging to find out what's going on. We're always talking to the key department directors. And then, report creation, that our growth readiness assessment report it's very robust when it's done. So it takes some time. When we go in and do it from start to finish, it's 90 days from the time we start acquiring the information to getting the surveys out, get on site, and then get the report generated for a client, which is complete with recommendations for future state. So how do you get from point A to point B so that you can effectively execute any strategy?
Awesome. Well, I think that's the only question I see on here in the chat room. So I just want to thank everyone. We're right at the top of the hour. Don't forget to check the website if you want to listen to this over and over. It'll be up there in the next week. And then the next webinar we have is for May 18th for burnout, not just about physicians, but about leaders as well. So thank you again. If you have any questions, here's my contact information. Don't hesitate to reach out at any time. Tommy, Diane, thank you so much. This was awesome.
Thank you, Tammy.
Thanks, everyone.